What's up, everyone? Welcome to our Austin, Texas studio. Week 5's Applied Kinstretch class is knee day. Everything knee today. Great class for you, running through everything we need. So, first thing we're gonna do is train our cars, and then we jump into some tough knee extension work. Then we're gonna focus on the tibia, followed by some challenges in knee flexion. We'll prep our hips, and then we finish with a really tough squat challenge. So, equipment you're gonna need today. Notice first of all the bench, that's a regression for those maybe a little bit limited in our squat, or if the knees bother you to kneel on. Otherwise, yoga block, tennis ball, something to squeeze. We do have 2 dowels. If you've got wall access, that's probably fine. Just make sure you've got balance here. Then maybe a pillow for that knee. Also notice we do have a yoga strap, something that you can actually use to grab your foot with. If you don't have a strap, don't worry, just grab a towel. So to get started, please seated position. We got wrist cars first. So seated position, anything that's comfortable for you. Let's go bilateral, both hands at once. Want palms to the sky, squeeze your fist. Gonna get some tension in those hands and those forearms. Drive your knuckles in towards one another, extend down to the floor, scrape out and drive up. Go slow, just 4 reps. Really wake those wrists up through extension, driving out, knuckles squeeze up to the sky, in and down. Remember, forearms are still. Out and up, in and down. 1 more rep. Drive those knuckles out, squeeze up to the sky, freeze there in flexion. Let's reverse. Driving out, extending down, fighting in, squeezing up. Slow reps only, out and down. Use that breathing, really waking everything up. Give me just 1 more rep. In, flex up, knuckles outside of forearms, squeezing down into extension, and we'll finish back into flexion. So with today's class, we really do need to prep our spine. With our knee training, you probably know this by now, a lot of common compensations where we tend to use our spine to make up where our knees are limited. So let's prep our spine first. Please, quadruped position, let's get our cat-cows. So let's get 4 reps. First 2, let's go from the pelvis up, and then the last 2 will go from the neck down, a little bit tougher there. So hands driving forward in the floor. I want you to slowly tuck the pelvis, round that low back, working your way up 1 millimeter at a time. Find your thoracic spine, concave to the chest, your chin will drop down. Get a breath in and out, and now drag your hands towards you and reverse, tilting the pelvis to the sky. Reach that pelvis, slowly pulling into that lumbar, lifting the chest, peeling between the shoulder blades, and your eyes will go last. Nice breath in and out, pelvis will tuck, hands pushing forward, round that low back, that mid back, that upper back. Goes so slow, match our tempo. Chin to chest, hands reversing, drag towards you. Pelvis tilts, extending slow through the lumbar, lifting through the T-spine. Show your chest up before your eyes. Eyes go last. So this time I'm gonna flip directions. Keep those hands pushing forward, but now round neck down first. Try and lead with that thoracic flexion. Upper back, mid back, lower back. Pelvis tucks under. Hands drag back towards you. Don't rush this direction, but lead with the neck. Cervical spine extends. Peel upper back, mid back, lower back. So tough. Pelvis last. Last rep. Hands forward, chin to chest. Upper back, think crunch. Pull yourself into flexion. Mid back, lower back, pelvis tucks under. Last half rep. Drag hands. Lift eyes. Peel collarbones, chest, sternum, belly, pelvis last. So we prep things there in quadruped, and next up, let's actually come down side lying. I'm gonna have you lay on your left side, gonna train our hip cars and then some knee cars there. Grab that tennis ball. So side lying here, support the head with your hand, use your yoga block, whatever you gotta do. Now, if you want, you can take the other yoga block, place it right behind your lower back, give yourself some cueing to make sure you don't cheat with your spine here. Wanna see that top pelvis point stay forward the whole time. Grab tennis ball behind that right knee. Take a moment, good tension, you're gonna get 4 hip cars here. Slowly. Now, I know it's tough to see, but notice for Danny, there's the slightest bit of space away from the ground here. Try and maintain a little tension in those side abs and those obliques, almost like a side plank. You can use that top hand for tension. Breath in, slowly flex hip forward, open hip out as far as you can. Freeze there, internally rotate, reach in, drive behind you and slowly lower down. Freeze, let's reverse, drive back, drive up, 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 heel pulls under, drive up to armpit and slowly lower down. irradiate that tension on the ball, reset your hand, rep 2, flexing up, opening out, drive out, keep this knee down, internally rotate, reach heel behind you, pull, slowly lower, we'll reverse back, extension, external rotation, knee out, heel under, pull up towards armpit, decelerate back down, go slow, don't care how far this is, keep it strict, flexing, opening out, abducting, internal rotation, reach behind you, challenge that extension, lower down slowly, let's reverse, reach back, drive knee up, heel pulls under, keep that low back slightly away from the floor like we just talked about. One more rep here. Reset your tension, irradiate, crush that ball, forward, open that hip, challenge internal rotation, wind that hip in, reach back, squeeze down, gotta reverse, extend thigh backwards, knee drives up, heel pulls under all the way up towards that armpit, and then we will slowly lower down. Once we get there, we're gonna stay in this position. Tennis ball is gonna come out of the way. I'd like you to grab that yoga block, throw it in between your thighs. Really tough knee car variation. First, we'll do some capsule cars and some global knee cars in this sideline position. Great way to challenge some hip and some knee together. So first step, squeeze that yoga block, max out your hip internal rotation. Lift that heel up as high as you can. Don't cheat with pelvis, don't cheat with low back. From there, lower down a little, not quite an end range of hip, but in some hip IR. In that position, good ankle dorsiflexion, irradiate out shin, think hamstring, slowly turn your shin in and turn your shin out. Fight for knee rotation in hip IR, turning in, turning out. Don't think about your foot, but think of the shin itself, turning in and squeezing back out. Only 4 of these, just one more, turning in, turning out. Now, come back to that starting position, and what we're gonna do now, global knee car in this position. Turn your knee in, squeeze your hamstring back, not too far, externally rotate, straighten almost all the way, don't quite lock. Turn your knee in, squeeze back, keep your heel up high, challenge that internal rotation the whole time. Externally rotate, extend that knee. No cheating with that low back. Internal rotate, hamstring curl, squeeze that back of the knee. Turn your knee out, extend, reach, feel quad, push. IR squeezes back. Freeze in that position, let's reverse. Staying internally rotated, extend the knee, tough this direction. Externally rotate, fight for it, hamstring curl, keep that heel up, Danny, keep that heel up. IR, reach that knee straight, squeeze. ER, hamstring curl back, pull that heel towards the hip, go slow. Internal rotation straightens, external rotation hamstring curl. One more rep, challenge yourself. Hip and knee are getting tired, I know. IR extends, ER flexes. So finish through 4, set that foot down. Let's flip over, hip and knee cars on the opposite side. So now we're down on the right side to hit the left hip and the left knee. Again, for these hip cars, ball goes behind the top knee. Yoga block can go behind the lower back. You don't have to use the yoga block, but a great idea to help us keep these strict. Remember, pelvis point stays forward, a little bit of space between the lower back and the floor. Use those obliques, use those low abs. Generate tension, squeeze that ball, nice and slow. 4 reps. Flex hip, open hip out, challenge yourself, Danny. Internally rotate, reach behind you, squeeze, lower down, slow. Not as far as you can, but as controlled as you can. Extending back, driving knee up, heel pulls under, fight up towards armpit, slowly lower down. Rep 2, flexing forward, drive that knee out, hold that internal rotation, turn thigh and reach behind you, slowly decelerate down, check in with your lower back. Extend, drive your knee up, your heel follows under, fight up towards armpit, and decelerate down. Rep 3, reset, hand tension, squeeze that ball as you open the thigh out, internal rotation, don't drop that ball, challenge yourself. Now extend back, reach, drive your knee out, your heel under, pull up towards that armpit, slowly lower down. One more rep, take your time, don't rush these. Flex, open out, use that breathing to help challenge that internal rotation, make sure you reach back before you lower down. Last half rep here, reaching backwards, driving knee up, heel pulls under, fight up towards that armpit, and slowly lower down. As you get knee to knee, kick tennis ball out of the way, and now grab that yoga block from behind you and place it in between the thighs. Love these sideline knee cars and knee capsule cars. A lot of demands here. We challenge that tibia in hip internal rotation. A lot of carryover to something like a 90-90 challenge. So in this position, good tension on that block. Go ahead, max out hip IR. Lower down a little bit, not quite an end range. Now irradiate, squeeze shin, squeeze hamstring slowly, turn tibia in, turn tibia out. Just 4 reps, not as far as you can think. Internal rotation, external rotation. Don't think about your foot, but the knee itself. Turn that shin in, Turn that shin out. One more, and then we go into global knee cards. Internal, external. Now, right back into IR, right into it. Squeeze hamstring all the way back. Turn that knee out. Keep your heel up, Danny. Extend, 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 extend. Right there. IR squeezes back. Max out knee flexion in tibia internal rotation. External rotate tibia. Don't quite lock the knee here, but challenge control. IR, beat me back, Danny. Hamstring curl, pull, pull, pull. Go slow. ER, keep that heel up. Squeeze quad, squeeze quad. Just one more will freeze in flexion. IR squeezes back all the way. Hold that reset ankle. Try and straighten forward now, knee turned in. Don't quite lock. To be an ER, keep that heel above me as you squeeze back. Keep that heel up, keep that heel up. Great job. IR extends. Nice and slow. Use your breathing. Check them through lower back. External rotate, squeeze. Hamstring. Use that posterior knee. Challenge your control in this weak point position. IR extends. ER, flex, last rep here, finish through, and we'll slowly lower down. Brings us to the end of our CARS warm-up. So please come out of that side lying position. Have a seat for a moment, but next up, you are gonna need both dowels and probably a pillow for that knee. So next, we'll be in a half kneeling position with the right leg in front. I do want you to have 2 dowels for both hands. If you don't have 2 dowels, have your hand on the wall, have your hands on the couch, whatever you've got. We're training our hamstring pails in homework. We're doing it standing using the bench. Today, that can be the regression. You can definitely stand instead. We've already given you that setup. The cueing is the exact same. Now, in half kneeling, it's gonna be a little more intense. More load on that hamstring, on that posterior knee tissue and all that tissue in the back of the leg. And then there's a lot more control required of the lower back. So come into the setup, and then one quick thing is only being up on the pillow here, if your hip flexion is very limited, you know you don't have that much knee to chest, you could actually go up on something a little higher to make this easier. We want it to be about the hamstring today, not the hip flexor. So if you needed to, just go off your yoga block under that back knee instead. That's the regression. From there, just gonna straighten that right knee out in front, and I want a very slight knee bend, the slightest bit of knee flexion. In this position, just start breathing. 2 minutes on the clock. We're gonna spend a good bit of time in this passive stretch. So as you find the stretch, we wanna bow it. So think anterior pelvic tilt, tailbone to the sky. Try and drag your hip behind you a little bit. Slightly lean that torso forward. Again, try and keep that knee a little bit bent. I know it's tricky. You're gonna find a hamstring stretch as soon as you bow. So it's anterior pelvic tilt, finding that spine extension, and then that slight lean forward to counterbalance that hip reaching back. Big stretch in that hamstring. Breathing here. If you feel this directly behind the knee, soften the knee even more. You can bend that knee a bit more if you need to. If this position is too intense on the bottom knee, if you maybe feel like it's just really intense for you on this hamstring stretch to be here, regress and go standing, same position, that right leg up on the bench instead. As you breathe here, you're trying to sink deeper and deeper into the stretch. With each inhale, notice that stretch. With the exhale, try and exaggerate your bowing 1 more millimeter, a little more pelvis, a little more spine extension. Really reach that hip behind you. You could maybe play with some slight angles of hip rotation here as we get our time in the stretch. Try some axials. Turn that thigh out, turn that thigh in. Again, we want the knee a little bit bent here. Keep breathing. So we're not starting yet, but we are going to train pails and rails in this position. We've not done rails yet for knee extension. It's a little bit tricky, so please pay attention as I chat through the cueing. Pails really simple, not starting yet, but your pails effort would be that isometric hamstring curl through the floor. So imagine I'm right here, I grab behind your shin. As I start cueing pails, you're gonna be trying to bend your knee through the floor as if you were pulling your heel back towards you against my hand. That's gonna strengthen all that low hamstring tissue. So, not starting yet. We'll train our pails, and then we're gonna go right into rails. Rails is tough because we're actively attempting to hyperextend the knee as we pull deeper into our bowing. It's not gonna look like much, but basically, Danny's now gonna be trying to use her quad to lock the knee out as she gets more anterior pelvic tilt, as she reaches her hip back more. That would be rails. So keep breathing here, last few breaths. Your next breath in, try and trap it low in the belly. Try and radiate tension. Think about your hamstring, think about your glute. Your pails effort, we're gonna start very slow. Start attempting to squeeze your heel backwards through the floor. You're trying to bend your knee through the ground. If your knee's more bent than Danny's, that's fine. Don't overthink it, but you're trying to pull backwards against the floor. Imagine my hand right here. I'm gonna start trying to pull your heel away. That's gonna force you to ramp up tension. Think 10% effort, dragging. 20% effort dragging, 30%. I want you to work slowly up to a 50% effort. Keep going, 40%, 50%. Give me 10 seconds. Drive that hamstring. 5, 4, 3, 2. Your rails effort, you're trying to squeeze your quad, lock the knee, reach into the bowing. Reach into the bowing, get your ankle involved in it. Squeeze. 5, 4, 3, 2. Relax into it. Breathe. Try and stay in this new position. You're bowed further, anterior tilt. Long spine. Maybe we soften that knee a little bit. Second round of pails. Breath in, trap it low or radiate, hamstring, glute. Start ramping up that tension. Imagine my hand behind your heel trying to drag your foot forward, fight back against me. 10%, 20%, 30%. You're climbing up that scale. 40%. I want to see those shakes start kicking in. 50%. Get your upper body involved. Stab those dowels. More tension. 60. Trying to drag your foot away. Don't let me. 70%. Find what you think is 80% tension and fight there. Maintain. Keep driving that heel behind you. 5, 4. Hamstring should be screaming. 3, 2. Rails. Squeeze your quad. More bowing. Try and squeeze your ankle into dorsiflexion. Pull with all this tension on top. 5, 4, 3, 2. Now relax into it. Breathe. Sink into that hamstring stretch. Down, regulate that nervous system, let everything relax. So, breathing here. The first step to a healthy knee is terminal knee extension. If you have some history of knee issues, you want to really prioritize that low hamstring. Get that knee to lock out, feel strong in extension, then we'll chase other things. So let's save that work. We're going to have a seat in a figure 4 position, right leg straight, left leg folded in. So figure 4 position, I want your hands set behind you and I want you to start driving laterally through those hands, or radiate out that upper body. In this position, I do want to regress the angle of torso towards thigh. So you can lean back a little bit. If you know, again, your straight leg hip flexion is limited, maybe you sit up on a pillow to regress this drill. What we've got, we'll demo one, but we're going to train a hip flexion liftoff with a knee hinge, trying to train that end range of knee flexion and extension in end range of hip flexion. Really tough challenge. So much carryover to a lot of our lower body training. In this position, again, this is a demo rep. Watch here. Tension in those hands. Breath in. Danny's going to lift that leg up high. Max out hip flexion. Hold that. She's going to squeeze her heel back towards her hip, keeping the knee where it is. And then she's going to straighten up as high as she can without dropping the thigh down. That's one. We'll slowly lower back down. Now, when we do these together, we are not going to reset each rep. We're going to keep that leg up high. 4 consecutive reps. So, same position. Or radiate those hands. Lean back a little. Breath in. Think short hip flexor, lift up high, lift up high, lift up high. Hold, maintain that thigh stays on my finger. Bend the knee, bend the knee, bend the knee. Extend forward, keep the thigh up, keep the thigh up. That's one. Bend back. If you can't lock your knee, that's okay. But it shows you want to train that knee extension. Extend up, bending back. This is so tough in hip flexion. Keep your knee towards your chest. Rep 3, straighten, straighten, straighten. Squeeze back. Danny makes it look easy. Keep that chest up proud, knee towards chest. Extend, extend, extend. Slowly squeeze back down and then decelerate. You can just let that foot sit where it is. Now, in this position, get a breath or two. We get our level 3 pails and rails for knee extension. Half kneeling, we save that work with some figure 4 knee hinges. Let's get that left knee back in your half kneel, find your pillow, find your dowels. Again, come standing if it bugs you to be on the knee for this long. So we come into our half kneeling position, we extend that left leg in front. Remember, we've got to bow the stretch, find that hamstring stretch before we start our 2 minutes on the clock. Anterior pelvic tilt, lengthen that spine into extension, hip drags back as that chest leans forward. That's about it. Don't go too far where your pelvis will start to turn. Make sure this pelvis point stays back. In this position, we're breathing here. 2 minutes on the clock. With the inhale, notice the stretch in that hamstring. With the exhale, deepen your bowing. These first 10 breaths, you're just relaxing into it, checking in. Maybe you play with some of that hip rotation we spoke about, a little axial. You can turn thigh in, you can turn thigh out. Doesn't matter how far you can get that hip rotation, but what you're doing is just exploring the stretch. Do you feel more hamstring stretch in hip IR or in hip ER? It doesn't matter, but it matters that you find the best stretch for you. Might not look just like Danny's setup, but that's okay. Remember, your knee can be a little bit more bent. Doesn't have to resemble the position exactly. Breathing here. I know it's tough to tell, but Danny's knee is slightly bent. Have a little bit of bent knee. Try not to lock that knee out all the way. Remember here, pail is pretty simple. It's just trying to squeeze that heel backwards to the floor, not sliding yet. Rails, though, that's the tricky one. You're trying to actively lock the knee. You're going to squeeze the quad. You're going to use that ankle as you deepen your bowing. So you're actively trying to extend the knee as you pull further into the stretch. Keep breathing here. Breath in and breath out. One thing as well to play with is your ankle. If you max out dorsiflexion, it's going to give you a bigger stretch. But if you max out dorsiflexion and it starts bothering the back of the knee, it might show you something. So relax the ankle a little. Again, keep playing with this stretch, but make sure you're in that anterior pelvic tilt. Make sure that spine is long. You're really reaching the chest forward and the hip backwards. You're not spinning that pelvis away, faking with spine rotation here. So keep breathing. Our next breath in, trap it in the lower belly. I want you to radiate that tension. We've got our 2 rounds of pails and rails. First set, a little bit less intense. Hamstring, glute involved. Start to slowly bend that knee through the floor. Imagine my hand coming behind. I'm going to try and drag forward like this. Beat me back by trying to squeeze that knee through the ground. 10% ramps 20, 20% ramps 30, 30% ramps 40 and 50. Stay there, fight. 10 seconds. Teach that knee to strong in this weak point position. 3, 2, 1. Rails, lock, quad, squeeze ankle, dorsiflex, pull deeper into your bone. 5, 4. Don't lose that spine extension. 3, 2. Relax into it. Knee is soft. Check in. Pelvis squared forward. Spine a little bit longer, Danny. Really irradiate through those dowels. Second round. This time we're getting up to that 80% level. Really trying to build some strength here. Breath in. Trap that low. Irradiate. Hamstring and glute. Start to bend that knee. Slow set. 10%. 20%. I'm really going to reach behind. I'm going to try and move your foot forward. Don't let me. 30%, 40%. Dowel starts stabbing. Upper body gets involved. 50, 60. Hamstring should be screaming. I want to see shakes. 70%. Stay in a pain-free range. 80%. Fight there. Maintain that effort for 5, 4, 3, 2. High tension rails. Lock quad. Squeeze that ankle up. Pull into your bowing. 5, 4. Don't round that back at all. 3, 2, 1. Sink and breathe. Melt into knee extension. Make sure that pelvis is squared. A breath in. A breath out. As you feel ready, you're coming out of half kneeling back into figure 4. Let's save that work with our knee hinges. Let's tie in that knee extension with that hip flexion challenge. So hands are set back. We pre-lean a little bit away. Tension through those hands. Lock your ankle, lock your knee, hip flex up as high as you possibly can. Join us here. Keep that thigh up, bend your knee, bend your knee, bend your knee. Extend that knee up high, but keep your thigh up as best you can. Continue. Rep 2, bend that knee, extend up, extend up. Challenge hip flexion here. If you can't quite lock the knee, that's okay, but work for it. Bending back, bending back, bending back. Rep 3, chest stays proud, don't round away. 1 more rep. Squeeze that knee flexion, feel hamstring. Challenge hip flexion as you straighten up. Finish through that 4th, back down, and then we will reset. So, all done with knee extension. As we start training everything knee, what do we need? First step, make sure that terminal knee extension is strong. Make sure it feels good to lock the knee. Need it just to stand, just to walk. Next step, let's look at tibia rotation. We've got 2 options for you. First, we're going to look at some tibia IR. Second one, we're going to look at some tibia ER, and then we'll save the work with a challenge. What I want you to do is actually come into a shin box position with that right leg in front. So shin box position, all we have to do to load this lead leg's tibia into rotation is dorsiflex the ankle, really lock that ankle to dorsi. Now, with the opposite hand, you're going to reach underneath the pinky toe, not on the pinky toe, and grab the lateral foot. As you do that, make sure the ankle is still up in a dorsiflexion. So if you need to, you can even use your other hand to kind of wedge your thigh down, but you might not have to. If you, very gentle, you're not wrenching your knee at all, but if you pull very gently with this bottom hand, you're passively turning your tibia into internal rotation. You might not get a stretch in the knee, but that's okay, just breathe here. If you need to, you can post the hand down, but just get some breathing, knock into 2 minutes in the stretch, just a few breaths here. So, you're in this position. I'm just going to show you what the PAILS effort is. You're in tibia IR. PAILS is you attempting to turn your tibia out into your hands. You're trying to externally rotate the knee into the hand. That'll be PAILS. Rail is going to be trying to internally rotate further as if you're going to lift the foot away from the hand. 2 rounds, we'll keep this a little bit gentle. So in this position, I want you to squeeze hamstring, squeeze quad, breath in, trap it low. Start to slowly turn your shin out against your hand. Push. I feel some calf, I feel some hamstring, some quad, feel all kinds of tissue around my knee. Really emphasize getting that lateral shin and quad involved. Keep going, 10%, 20%, keep fighting, 5, 4, 3, rails. Try and turn your knee in. You're trying to internally rotate that knee as if the foot is going to float away from the hand. It should not. Now I feel it more medial. I feel all that inner knee, high calf tissue. 5, 4, 3, 2, and relax. Get a breath. One more round. As you've gained some terminal knee extension, next step, we check in with tibia. Internal rotation, that's where we start. Fundamental motion of the knee. IR tends to be very limited. Then we'll address ER. So same thing, you're in that dorsiflexion. Breath in, radiate, think outer quad, outer shin tissue. Start to push your foot down, trying to turn your knee out against your hand. 10%, 20%, 30%. This time I feel a little bit more lateral, really feeling isolating good tissue working, trying to push out of this weak point position. 5, 4, 3, 2, rails, try and turn the knee in as if you're gonna lift the foot away. I'm trying to max out that tibia IR. I feel all this medial tissue working now. 5, 4, 3, 2, and relax. Get a breath. Now, this left leg, you can kind of straighten it out of the way. You can keep it straight, almost like a figure 4. And now I want the right leg to come into kind of a half bear sit position. This position, great way to challenge your tibia ER. So if you think about it sitting here, if you can't grab your foot easily, if it's too much on your hip, you will need to wedge your foot against something. Maybe you set up with your foot against a wall, you could use the bench, you can use a yoga block pressed into something, whatever you've got to do such that you can grab onto the foot. So in this position now, the knee's turned out, exact same cueing, but now we're in the opposite position. You're gonna try, for pails, you're gonna be trying to turn your shin in against your hand. For rails, you're gonna try and turn your shin out. Remember, we do not wanna see the femur move at all. Thigh is still. In this position, get a breath in. If you've got a lot of hip like Danny, notice what she's done. She's going inside of her leg like this. If your hips may be a little more limited, you can go outside of the knee like this, whichever feels better for you. Again, if there's any pinch in your hips, sit up on your pillow here. Breath in, I want you to irradiate. Now we want for pails, medial tissue of the knee. Start gently turning that knee into the hand. Don't go too high tension, but keep that ankle dorsiflex. Try and squeeze your shin in. Want to feel all this tissue working here. Low levels of tension, 10%, maybe 20%, 5, 4, 3. Rails, you're gonna try and turn your shin out. Don't actually lift off, but you're trying to turn your knee out using tension on the outer knee. 5, 4, 3, 2, relax into it. Make sure your ankle's locked in dorsiflexion. Round 2. Breath in, irradiate medial knee tissue. Start turning your knee into your hand. Fighting in, 10%, 20%, 30%. Maintain, 5, 4, 3, 2. Rails, trying to turn knee away. I'm trying to almost lift away from my hand by turning that shin out. 5, 4, 3, 2, and relax. Get a breath. So, pails and rails for tibia IR, tibia ER. Love those options. Now, if either of those were really intense for you, just remember, you can always train a more traditional setup here for IR and a more traditional setup here for ER. I do like that bear sit and that shin box. I feel they carry over a lot. Now that we've loaded our knee rotators with some isometrics, let's save the work with a challenge. Come into a combat stance down on the left knee. So, combat stance position, you can have your hands down here, you can prop your hands on the bench, whatever you've got to do. If this is too much for you, you can do this in a half kneel, just make sure you've got your Dallas for balance. What we're gonna do, you can join us here, we're just gonna get 4 reps, max out your ankle dorsiflexion, squeeze your foot up, it's not gonna be much, feel that shin, try not to rock back, but use that tension in that anterior knee, and now challenge the knee capsule cars there. Imagine something under your foot that you had to hover the whole time. You're gonna turn that knee out as far as you can, don't cheat with the hip, and then turn that knee in as far as you can. Keep your foot up, keep your foot up, keep your foot up. Rep ends as you lose dorsi. Turning knee out. Tibia ER in ankle dorsiflexion. Tibia IR in ankle dorsiflexion. Go slow, just 4. Rep 3, pivoting on that heel, turn your shin out. Rep 3, pivoting on the heel, turn your shin in. 1 more. Knee external rotation and knee internal rotation. Think about a squat for a moment. Bottom of a squat, again, we've got a squat challenge coming later. You need this tibia rotation in this degree of knee flexion. So if your knees often bother you squatting, great option to start building in here. Let's go ahead and flip. We're now gonna get that IR for the left knee. So we're gonna come back into shin box. Remember, starts in 90-90, front foot comes in, just like that. Back knee still in line with the hip. From there, we're gonna dorsiflex ankle and grab underneath foot. So we're blocked into hip external rotation, and now we're blocking ourselves into knee internal rotation. Remember, you're not grabbing on the pinky toe, grab a little bit lower, and try and max out ankle dorsiflexion the whole time. If you need to post your hand, that's fine. In this position, get a breath in and a breath out. Remember, your pails effort is you trying to turn your knee out against your hand. We want to mostly feel lateral tissue working on the knee. It could be low quad, could be outer shin, could even be hamstring or high calf, but outer knee tension. Now, for rails, opposite, we want to feel that medial knee. So, breath in, trap it low, irradiate quad, feel that calf, Feel that shin. Start trying to turn your knee out into your hand. Keep it low tension. 10%, 20%. Fight there. Maintain. 5, 4, 3, 2. Rails. Try and lift that foot up. Turn your knee in. Pull. 5, 4, 3, 2. Relax into it for a moment. Get a breath in. Maybe a little bit taller. Make sure that ankle is still locked in dorsiflexion and that thigh is just set on the ground. Breath in. Radiate outer quad, outer shin. Start turning that knee out. Should be a little bit easier to feel it working this at 10%, 20%, 30%. Maintain effort, fighting. Build strength. Your knees tend to be so weak in IR. 5, 4, 3, 2. Rails. Pull with that medial knee tissue. Feel your shin, feel your low quad. Try and turn your foot in. Turn your shin in. 5, 4, 3, 2. Relax into it with a breath. Slowly come on out of it. We can straighten that right leg in front, come into that same half bear sit as Danny showed before. If you've got a lot of hip flexibility, maybe you're going inside the knee like this, blocking yourself into that bear sit. The hips are more limited. Bring that thigh in a little bit and grab outside just like this. Either way, if there's any pinching in your hip, sit up on a pillow to be here. So breathing into it, now it's the exact opposite cueing. Our knees turned out, tails we're going to try and fight in. Rails, we're going to try and fight out. This is an isometric. We don't want to be able to lift off here. I don't want you moving, but I want you fighting for strength in this position. So, breath in. Radiate, now thinking medial knee tissue. We want to feel that low quad, that high shin, that high calf. Start turning your foot in. You're trying to internally rotate through your hand. Keep maintaining that effort. 10%, 20%. Fighting there. 5, 4, 3, 2. Your rails effort. You're trying to turn your knee out as if you're going to lift the foot away. Turn that shin, pull. 5, 4, 3, 2, and relax. So tails, inner knee working, rails, outer knee working. Second round, a little bit taller, radiate, more tension here. Make sure that ankle's in dorsy. Start your pails, you're trying to turn your knee in, fighting that way against your hand. Keep going, 10%, 20%, 30%. Maintain that effort. 5, 4, 3, 2. Rails, try and turn your knee out, pull away from your hand. Try and show your shin that way. 5, 4, 3, 2, and relax. Get a breath. Quickly here, notice how your knee feels in internal versus external rotation. It's really common that we've got a lot more tibia ER than tibia IR. If that's you, probably shows when we get into our squat challenge at the end, it's going to feel a lot better for you to keep your knees turned out a little bit. Challenge yourself where you're at. If you know your tibia IR is limited, you shouldn't be squatting with straight toes. All our challenges should carry over. So back into combat stance, let's save that work. So combat stance, remember we want to really get that shin involved on this setup. Going to dorsiflex that ankle, try not to lean back, pull that foot up as high as you can. Feel your shin working. From there, going to turn knee out and turn knee in. Only as far as you can that you keep that foot up. Turn your knee out. If this is miniature, that's okay. Turn your knee in. These should be hard. Go slow. Rep 3 out. Rep 3 in. We're pivoting on that heel. We're turning our tibia out last time, and we're turning our tibia in last time. So again, check in that whole series. Whichever knee felt stronger, I bet you're a lot more confident in that knee. So thinking like order of operations as we train our knee day, we check the list. It's knee extension first, strength and terminal knee extension. How's that hamstring? Can we use our quad in that position? We save that work with our hip flexion work. Then next up, we check off tibia internal, tibia external rotation. Good challenge in combat. What's next? We've got to train knee flexion. Now, what we're going to do today is introduce an option that Danny and I actually train a lot in our personal practice. We're going to do a knee flexion positional isometric. A little bit different than a pails and rails, just means we're not going to start in our end range. We're going to start in some range of motion and work our way back towards end range, getting sets at each angle as we go. Really like this prone with the strap as it's just simpler. We've done a lot of knee flexion work up here. We can, do our passive range holds. A lot of training we do happens in that half kneeling position, and there's so much hip extension and lower back to think about. Today, because we're so focused on just the knee, want to really get simple with this. All you have to do, lay it on your face. We're going to take the strap around our right ankle, and we're going to pull up with our hand to use the strap instead of having to hold on with your foot. You can definitely do this with a towel. You would just roll a towel up and put it around your shin and then use the towel to pull up. Otherwise, if you just don't have anything, you can do this with your foot on the bench instead, and you would just be in that traditional setup we've done before. So again, you're going to take the towel, loop it around your shin. I would suggest grabbing in your opposite hand unless that feels awkward. use the strap, use the towel, whatever you've got to pull yourself into knee flexion. Now, what I want you to do is stop as soon as you get some quad stretch. I do not need you to max out knee flexion. Again, positional isometric. So back up a little, right about there for Danny. Probably a good starting point. What we're gonna do is train 3 rounds. Each round, we're gonna sneak a little bit deeper into that range of motion. Things to think about, make sure your thigh stays nice and narrow. Often we'll jump too wide with our knee. Make sure our foot is right in line with our hip and not jumping in like this. You don't wanna bias any hip external rotation. So you're gonna try and find a slight hollow position of the low back, a little like you're trying to pull your belly in and tuck that pelvis. Use that to just set your low back in place, ankles nice and dorsiflexed. In this position, positional isometric is just basically a quasi-pales, not an end range, and we're not gonna go as high tension. So breath in. I want you to radiate, think about your quad, start pushing forward into that strap. It's not gonna move, but you're trying to drive the strap towards me. 10 seconds. Each second, maybe you push a little harder, maybe 5%, maybe 10%, 15, 20%, stay there, 5, 4, 3. Quasi rails is simple, just pull. Try and drag heel backwards and just hold that effort. Squeeze that hamstring and pull. 5, 4, 3, 2, 1, and relax. Get a breath. That was round 1, just teaching yourself to isometrically push and isometrically pull down prone without using that lower back. So now you can use both hands if you need to. Pull a little bit closer heel to hip. Again, you're not cranking. This is not end range yet. Find that slight hollow of the belly. Find that pelvis tuck. You're in that stretch. Remember, don't let your foot jump in. Breath in or radiate, think quad. Start trying to straighten your knee towards me. Imagine me here, right here. I'm trying to push. I'm trying to drive your shin that way. Fight back. 10%. 20%, stay there, 5, 4, 3, 2. It's a quasi rail, so don't move, but just squeeze that hamstring out. Pull. Try and pull that heel back against the strap. 5, 4, 3, 2. Relax into it. Get a breath. So now we get about into end range. Here it is a little bit tough to get that heel all the way to the hip with the straps. If you don't quite find it, that's okay. Really important that we can find that hollow and that pelvis tuck. The whole reason we're doing this prone is to make sure this isn't coming from your lower back. This is a knee drill, not a spine drill. So breath in, make sure foot is here. Don't let that knee jump out. Squeeze your quad and start pushing. 10 seconds. This one a little harder. Maybe 10% effort. Maybe 20% effort. Keep going. 5, 4, 3, 2. This time I'm going to cue through a passive range hold, and I'm just going to ask you to hold it for 10 seconds. Slowly start letting go of the strap and just hold your foot where it is. 10 seconds. Pull. Keep heel towards hip. Keep heel towards hip. Squeeze that hamstring. Doesn't look like much, but you are working. 3, 2, 1. Relax. Pull the strap into the stretch for a moment. So knee flexion positional isometrics, working up to a tough passive range holds. Great option to train our knees, really strict knee flexion work. Again, good regression option is always that couch stretch set up against the bench. Slowly bring that leg back down. We're gonna get the other leg, and then we've got some kinetic natural leg extensions afterwards. Really tough challenge. So same exact setup. Now we're down on the opposite side. We've got that left leg pulled up, strap, towel, whatever you've got. Again, we like to use the opposite hand to pull. If you use the same hand, it's gonna really bias you too much that way, which we do not wanna see any hip rotation here. So in this position, remember, the first set is really just wherever you get a stretch in your quad, a slight stretch. To find that stretch, we have to bow the stretch. How do we do it? We find that slight hollow of the belly, and we try and find that pelvis tuck. If you cannot find your pelvis tuck, it means you are too far into knee flexion for now. So get a breath in. Think about your quad. First set's a little gentle. You're gonna start pushing your shin into the strap. You're trying to drive me away, push. Don't beat the strap, just maintain effort against it. 10% effort, maybe fighting there. Continue. 5, 4, 3. Quasi rails. I know it's gentle, but try and pull the heel back into the strap. Just feel that hamstring work at this angle. 5, 4, 3, 2. Relax into it. Now we're going to go about 10 degrees further. Don't overthink it. Pull a little more. You can use both hands if you need to. Now a bit more of a quad stretch, but you're not in end range. You're not cranking. Find that hollow. Trying to pull belly away from the ground. Find that pelvis tuck. In this position, maybe a little bit of ankle involved. Breath in, start irradiating and push. 10% effort. Driving through that quad, trying to push the strap towards me. Imagine me right here trying to push back. 20%. Fight there. 5, 4, 3, 2. Quasi rails. Squeeze that hamstring. Imagine me right here. I'm trying to pull you towards me now. Fight back. Fight back. 5, 4, 3, 2. As you relax, pull more with that strap. Try and get towards end range, maybe not quite all the way into it. right about there for Danny. She can keep that ankle. Find that hollow belly. Find that pelvis tuck. Last round, remember we're going into a passive range hold for that last set. Breath in, irradiate, think quad. Start pushing 10%, 20%, a little bit harder. Keep fighting. I'm going to try and move. You don't let me. 30%, right there. 5, 4, 3, 2. For the hold, you're going to slacken and then just hold there. Let go of the strap. Hold. Don't let it lag. Keep that heel towards you actively. Maintain. 5, 4. Should be harder than you think. 3, 2. As you relax, grab back onto the strap and pull into passive stretch. So, as we've trained our tibia after our knee extension, that is now the time to start chasing knee flexion, getting more quad and more short range hamstring. Now that we've prepped with our isometrics, we have a challenge up next, but the challenge is sitting back on plantar flexed ankle. So before we do our kinetic natural leg extensions, come to a seated position. Let's prep with some ankle capsule cars. So back in kind of a figure 4 position, but keep the knee a little bit bent. That way you can really lock out your ankle. Maybe hands go behind the knee like this. I want you to max out your right ankle plantar flexion. Point those toes down as far as you can. And now give me 4 slow capsule cars. Inverting the ankle and everting the ankle, but keeping plantar flex. You're just turning your ankle in as far as you can and turning your ankle out as far as you can. Go slow. Just carve this motion. Internal and external. This one's always tricky because as you go in, that's inversion, and as you go out, that's eversion. Always tricks me. So just 4 of those. Let's get that opposite side. Prepping our ankle rotation in plantar flexion before we get into plantar flexion. Same idea, maybe slight bend in left knee now. Gonna plantar flex down all the way, and now we're inverting that ankle, and we're everting that ankle. Really easy way to self-assess, compare each side. Turn foot in, turn foot out. Gonna feel a lot of tissue working. Foot cramps here, really common. Internal, external. Last time, invert that ankle, evert that ankle. So ankles prepped, knees are really prepped. It is time for some natural leg extensions. Here, if it bothers you to be on the knees, I want you to go knees on the pillow, but if you go knees on the pillow, it is gonna throw off the angle a little bit. So I'll have Danny demonstrate on the pillow. I'll go without it, but you're gonna come into a tall knee with your feet pointed back behind you. So kinetic natural leg extensions. We're going to demo one first, so don't worry. We'll join for 4 together. The idea of this, remember, the kinetic rep is trying to actively pull into the position and push out of it. We've done this in a squat. The cueing is a little tricky, but really it's pretty simple once you get the hang of it. So in this position, again, not starting yet, basically what we'll be doing, again, we're going to demo one first, but as we lower down, I'm going to be trying to pull with my regressive hamstring. That's what you just used for that passive range hold. So you're trying to squeeze short hamstring like this to pull yourself down. As you do that, so important to keep your pelvis tucked and your ribs down. Again, this is a knee drill, not a spine drill. If I start seeing you like this as you lower down, not the intent at all. So pelvis tucked under, ribs set down like a good plank. We're gonna pull with our hamstrings, pull with our hamstrings, pull with our hamstrings. As we get to a point, we start to lose that pelvis tuck. So I do not wanna see this at all. That's about it for most of us. You don't have to go that far. We're gonna push through our shins using our quads to press back up. So we'll demo 1, then join us for 4. Pelvis tucked under, ankles are firmly on the ground. Hands in front, can squeeze fists or clasp palms. Head back, pelvis tucked. Think hamstrings, pull, pull, pull. Find end range, and whenever you get there, push. Push through shins, drive all the way back up. Kinetic natural leg extension there. Tough. It's not about flexibility. Don't worry about how low you can go. Keep this about strength. So just 4 reps, about a 5 count down, 3 count up. Breath in, irradiate, squeeze hamstrings. 5, 4, 3, 2, 1. Push up, 3, 2, 1. That's 1 rep. Reset. Pelvis tucked. Pull. Pull, squeeze hamstrings, squeeze hamstrings, squeeze hamstrings, squeeze hamstrings, and press up, press up, press up. Try and match our tempo. Rep 3. Pull. Pull. Go slow. Hamstrings screaming, and push through those shins. Try and keep this active. Don't get sloppy with me. Use those hamstrings. Pull yourself down. Last time, and press yourself back up. So one tough challenge there to really tie in that knee flexion. But as I mentioned, to finish up knee day today, we have a squat challenge. Before we get into our squat, I do want to prep a little bit of just hip rotation. So simple drill here. Let's just get a quarter hip car supine, get those hips moving a little bit. So lie on your back and have that pillow under your head. So hands down on the floor. When we think about a squat, we need hip flexion, we need hip rotation, we need hip abduction. A quarter hip car supine really works on that. So right leg's gonna lift up. We're gonna start by externally rotating as we scoop across. Max it out. Now open just a little bit. Open out right there. Freeze, pull back across, heel across, lower down all the way, reset. We're just doing 4 of these. Really prep everything we need. Lift up, Externally rotate, pull heel up, open out, challenge abduction. Control it though, pull back, heel leads across, and then lower back down. Make sure this bottom leg, high tension. Rep 3, lifting up, scoop, pull up, heel towards chest, open out, lead with the knee, heel stays in and reverse back, driving across, lowering back down. Got one more rep here. Breath in, tension through hands, scooping up, pull that heel up high, open out, freeze and reverse back. Heel leads across, slowly lower back down, and let's prep our left hip. Please just flip around. Last prep drill, and then we've got our challenge. Left leg is gonna lift up, scoop across, pull up, heel towards chest, open out not too far, and drive back. Keep your heel inside of your knee throughout to bias that external rotation. Reset, rep 2, lift. Heel across, scoop, fight out, open, but keep heel in, reverse, squeeze across, tension through bottom leg, nothing sloppy, just 2 more. Hands driving down, lift that leg up, pull across, fight, heel up towards chest, open thigh outside of shoulder, and then reverse back, heel leads across, and then decelerate down. Just 1 more of these quarter hip cars, lifting up, scooping, drive, heel towards face, and then slowly open out. Reverse back, heel leads across, and decelerate back down. Get a breath. So, I know it's a lower body focused week, but our challenge today to finish up knee day is going to be swimmer hovers. Upper body challenges in our squat based position. It is a great way to put our knees to the test. When you do something like a swimmer hover, something that dynamic in your squat, it's gonna force a lot of challenges. Your tibia, your knee rotation is gonna have to work. You're gonna have to use all that hamstring, all that shin tissue we've been working today. Great way to put everything to the test. To make this a little more knee focused, what we're gonna do is actually a 2-position swimmer hover, meaning we're gonna do in about a half squat, a parallel squat, a swimmer hover there, a very knee dominant squat, and then we're gonna get as low as we can get into an ankle and hip dominant squat, bottom of a squat position. For either of these, if you need to regress it, I'll just sit on the bench. Very simple. If you want to challenge yourself, maybe you sit on the bench for the first set, and then the second set, sit on something lower, like your yoga blocks, to more resemble that deep squat. Otherwise, please come up. We're gonna come into that half squat for our first swimmer. I'm gonna warn you now, this half squat swimmer hover is gonna be a lot harder than you think. It's super knee dominant, really hard. So bring your hands to your lower back. You can turn the knees out a little bit. If you saw you've got a lot more tibia ER, be in a position that you've got strength here. So in this position, you're gonna slowly squat halfway down, right there. Hold, knees forward and out. Take a second, swimmer hover challenge. Big breath in, shoulder blades, hands lift, straighten your arms back. Slow, Danny. Externally rotate, drive overhead, keep your hips low. Max it out, bend your elbows, search for the back of the head. That's a half rep. Take a second, stay low. Shoulder blades, hands, extend up. Internally rotate, reach behind you. This is the tough part. Max out IR, don't lose your half squat. Bend those elbows, find the bottom of your back. Now, if you can, sit into your squat. Sit down, take a second. Puff that chest in. Big breath in. If you need to rest and take a moment, you can. Find shoulder blades. Hands lift. Extend elbows straight. Reach. Externally rotate. Drive up. Find that Y position overhead. Bend those elbows, searching for back of head or neck, and set down. Take a second. Get your breath. Tension your squat. Shoulder blades. Hands lift. Straighten those elbows up. Awesome job, Danny. Strong in that squat. Internally rotate. Reach behind you. Challenge your hamstrings. Use your shins. Make sure that knee is still working. Bend those elbows and set down. Now you're going to slowly stand up all the way. Get a breath as you need to. If you need to rest, that's fine. But we are going to do a second set. One last set, last tough drill of the day. If you want to switch it up a little, try hand starting on the back of the head. Swimmer hover, we can bias ER by hands up top or IR by hands on the bottom. So take a moment. You're going to squat down halfway, right there. Take a moment, knees forward, tension, big breath in. Find scapula, hands lift up, hinge elbows straight, letter Y. Internally rotate, reach back, challenge your squat, bend those elbows, set down. Knees forward, knees out, big breath, proud chest, Danny. Shoulder blades, hands lift, extend elbows, externally rotate, drive overhead, squeeze tight to those ears, keep your squat where it is, bend those elbows, and set down. Breath. Now sink lower. Find bottom of squat, get that chest up. Try not to make it all hips and lower back. Find that anterior pelvic tilt if you can. Last tough rep of the day. Lift those hands, straighten your arms, find your letter Y. Internal rotation, reach behind you, squeeze back, keep your squat, bend those elbows, searching for the back, and take a breath. Shoulder blades, hands lift, Elbows hinge, externally rotate, drive all the way overhead, reaching towards the sky as you find letter Y, bend those elbows and set down. We have finished our squat challenge. Slowly stand up. So it wouldn't be knee day without sneaking in one more weak point. This is technically a car that we haven't really trained yet. It's a patella car. It's a little bit tricky. So I'm gonna have you come back down to the floor in a figure 4 position. We'll talk about it. I want you to bring your attention back to the knee extension setup we did in the very beginning. Now, if you found that terminal knee extension was a little bit limited, maybe it was tough for you to feel it, a drill we often need to work on is a patella car, a controlled articular rotation for the patella, the kneecap itself. Now, as far as what the kneecap's gonna do, it's the same exact thing as a scapular car. Your patella is a floating joint. It doesn't actually insert anything, but it needs to be to glide smoothly in all directions in order to move with the knee. Often what you're gonna find is there's certain corners of the patella that it doesn't like. Now, with that in mind, your patella can't move by itself. If it can, that is impressive. You have to show us a video. Having said that, the patella car is assisted. You're gonna manually do this yourself, and it's weird because it's new. Everyone kind of talks about this one in the beginning. It's, oh my God, what am I doing? This is so strange. It's just a new movement. Be very gentle. You're not asking that much of it. But all you're gonna do, you're gonna grab your kneecap like this. So thumb on top, finger on the bottom, opposite side, thumb on top, finger on the bottom. Kind of grab your patella, and then really slowly, we're gonna do 3 reps of trying to move your patella through a circle. So I want you to drag up towards you, pull out away from you, press down away from you, and then in. Try and drag a small, smooth circle with that patella to control the articular rotation. Go 3, nice and slow. As you get through that third, freeze there and reverse. Go the opposite way. Up, in, down, and out. Nice and smooth reps. Now, what you're doing is you go through this patella car, you're exposing the knee to different stimulus. Which corner does not move well? Everyone's gonna have a different spot. Danny, find a spot that's maybe a little sticky for you. Find that bottom corner, maybe reaching down and away. It's really common. Come into that spot and hold there for a moment. Let's say you found a corner of your patella car that doesn't feel good. What you can do is a very simple pails for this setup. All you have to do, hold the patella into that position, try and find your ankle, Danny. Get your ankle a little involved, and then all I'm gonna ask is you to squeeze your quad. As you squeeze that quad, you're gonna feel that patella kind of reset a little bit. Kind of hold that quad. 5, 4, 3, and then relax. Let that patella sink back into that corner. So, patella car is just moving that kneecap through all the corners it can, each direction, nice and slow, like a car. When you find a spot that's not moving, hold in that position and get some tension. Now, take your time. We're gonna flip sides to finish. So grab onto that left patella, thumbs on top, index fingers on the bottom. One quick note, if you try this and you cannot move the patella at all, it's not moving, it probably shows you have some tension in your quad or your shin. You need everything relaxed. Really relax this leg, just let it be floppy on the ground, and then just slowly start moving that kneecap as we did before. So up, pulls out, squeezes down, fights in. Doesn't really matter which direction you go. The 3 reps, nice and slow. You're just doing your best to get that patella to travel in a smooth circle, paying attention to where it doesn't want to go. You may feel like it wants to jump around. That's okay, go slow. Now, get your third freeze and reverse. Opposite way. Up goes in, fights down, squeezes out. Nice and slow, 3 reps. Where is it moving? Where is it not moving? This is a nice way as well to get some blood flow deep to the kneecap. If you've got a history of some patella tendonitis, definitely an option I would be pursuing for you. So same idea, find that corner. It is not gliding as well. Really common, it's gonna be that patella trying to move down towards the ankle, and then it's gonna be whichever corner doesn't feel great for you. You can maybe pull that patella down and out or down and in. But hold it there, get a breath or two, and then we wanna generate tension to keep that patella strong in this position. So think shin, think quad, squeeze, a 10-second effort. Really radiate, lock out that leg. You're basically just terminally extending your knee, holding the patella where it is. 5, 4, 3, 2, now relax, and now pull that patella back to where it was, whatever corner you had it in, and you should notice maybe it's a little bit easier for it to be there. So breath in, breath out, and you have finished knee day. Now, this is everything we need to have strong and healthy knees and start to think about which prerequisites go into one. Obviously, knee extension so involved standing up out of a squat, involved in a deadlift or in a hip hinge. Obviously, our tibia rotation, so important for change of direction, or if we're squatting with our feet turned out, or lunging with our feet straight ahead. Knee flexion, we need that as we get all the way down into our squats, and then that patella is often something that's limiting us we don't pay attention to. So ideally, your knees are feeling really good because you are going to need them for this week's strength class. We've got a unilateral, tough lower body focus. Hope you enjoyed it. Drop some feedback.